I'd like to switch quickly because I know we have spent already a lot of time, but I'd like to go into the part four, which of the interview, which is the politicization of health, the politics, if you want, of health, and maybe generally speaking, could you comment on this politicization of health? Why a drug like hydroxychloroquine becomes a political drug? Why did it happen that way from your perspective?
I think now that Big Pharma has a lobbying efficacy much more powerful than 2 or 3 decades ago, and they control many parts of politics in the world. When I was at the United Nations in Geneva several years ago with a group of activists to defend the Lyme disease patients, we said that it was a violation of human rights, that there was a lot of corruption about Lyme disease. At the United Nations, they told us Big Pharma now is the first cause of corruption in the world. It's not me who says that, it's the United Nations. Unfortunately, they have no power on countries to control that. So I think now the governments are under strong influence of all that. For me, it's a pity because it's not anymore a national health policy. And it's a real pity.
In the US, you have this politicization left-right, Democrat, Republican. What's happening in France? What kind of political response was there to the moves by President Macron and Health Minister Olivier Véran to block any form of prescription of early treatment?
In France, several politicians spoke out about the COVID crisis and criticized the government, but they were not followed by the authorities. But now you have official commissions, now at the National Assembly and soon at the Senate, with representatives of the French population who are auditioning the experts, Minister of Health, who have to provide data about their process of decision. And I hope that some informations will be given about the processes of decision.
So you mentioned that during the crisis, it was your hospital and Professor Raoul's hospital in Marseille that were the two places where hydroxychloroquine-based treatments were provided. Do you expect more hospitals now to deliver that treatment if need be?
But during the epidemic wave, some hospitals gave hydroxychloroquine. I was not the only one, but some didn't give it to all the patients, and some did it nearly underground. Even in the Paris public hospital groups, some patients were treated, but it was a minority. Very few departments of medicine gave it to the majority of the patients.
Okay, but do you expect now that it's supposed to be authorized to prescribe again that drug? You know, now that the need is less. I guess kind of a crazy situation. But do you expect other hospitals to look at it, or do you think that the reputation of hydroxychloroquine has been so much damaged that they will not even dare touching it?
Now, at the end of August, I'm pessimistic because even if we have the majority of the studies in the world showing that hydroxychloroquine works, all the key opinion leaders in infectious disease in France are every day on the television to say that it doesn't work, that the only treatment which works is dexamethasone. So the medical societies say the same thing. So many doctors follow these advices. I'm more optimistic for the GPs because general practitioners, they saw that it worked during the epidemic wave, and they are very upset against the government. And now that they have the freedom to prescribe, I think that they'll do it now.
Okay. Well, dexamethasone is for another stage of the disease anyway, so many, as you know, many people, I think Professor Raoul, but I also interviewed some people in Brazil who said it was kind of a murder to do a randomized study with that because everybody knew it was needed. So when you deny thousands of patients the drug just to create a clinical randomized placebo-controlled trial, you end up killing people just by not providing a drug that was known to be needed. So it's a completely different stage of the disease and a completely different therapy than hydroxychloroquine based. How do you perceive the attitude of the media vis-a-vis you? How do you perceive the media today and how they play the role in this crisis in vehiculating information?
Most of the mainstream media follow the government, are anti-hydroxychloroquine. But if you look, now it's published in France, we see that some huge media receive a lot of money, for example, from the Bill Gates Foundation and from the government. So I think they are not completely independent. On the French TV, every night you see that it's terrible, the second wave is here, all the French people are at risk. And if you look at the data, you have maybe 2,500 new cases per day. 2 months ago, it was 500 patients dying every day. Now it's only cases, and most of these cases are young asymptomatic people. So it's not good information. And the AFP, Agence France Presse, when they give an information, immediately all the media copy this information and broadcast it without any, they don't check anything. Because I'm not against journalists, they do a good job usually, but they are not scientists. They are not able to compare the studies. And when they see experts who are fighting, they don't know who is right. So they follow the mainstream. So it's very difficult also for journalists to understand the real situation. Unfortunately, you have some independent medias not dependent on lobbies or advertising who can do a good job, but they are a minority at the present time.
So you mentioned the example of Agence France Presse, AFP. Have you had any opportunity to have a fair hearing from these people?
Usually, when I was interviewed in the media, they were fair with me. Sometimes journalists were not so in favor of my statements, but there was some mutual respect, and they didn't try to attack me or to put me in a bad condition. But because I think I'm recognized as with my career as a professor who did a good job during his career. And during 15 years, I was one of the main counselors for all the governments for the management of epidemic crisis. So when now I write my book to say they did very bad things, I think it is because also I know the system. I did that during years and years, and I know now that they did very wrong. They took very wrong decisions.
So do you think they give a fair hearing to Professor Raoult, the same people?
For Professor Raoult, I don't know why, because now he has long hair, beard, and he looked a little bit like a hippie, or he was a lot. He criticized a lot by journalists. They were not looking at his real scientific work. They were just looking at his look or his face or his way of speaking, and that's not fair.
Okay. What do you think about all the censorship that is taking place on social media? Have you been censored yourself? I know that you are going now. You have interviews with millions of views on and on national TV. So you're a very well-known figure. But are you also subject to censorship?
Personally, I was not subject of censorship, but I can see many examples of censorship on the videos made by very nice people who did a very good job. And recently there was a video about the population immunity with coronavirus, showing that probably it could protect many people in the population. In 20 minutes, it was censored. And when you see that the director of Facebook said every message in favor of hydroxychloroquine will be suppressed immediately, and now I have examples, it happens. For me, it's terrible. It's like the beginning of the Nazi regime in Germany, with the censor of truth. We have to respect the liberty of thinking, of speaking, and I'm very upset about what's happening, and it's. I think I am afraid of that.
So who is the minister of truth these days? Is it Bill Gates or is it Mark Zuckerberg? Who is it?
I don't know. Ask them.
Your book obviously has had success. Many people read it. Many people are probably mad at you for having written it. What's the feedback from you from a personal viewpoint? What's what do you get from this experience of having dared writing this book about everything that went wrong, from the masks to the testing to the therapeutic response to the prohibition of hydroxychloroquine to the total incapacity of the government to do the right thing in a timely manner? What has been the feedback to you? Are you happy to? Are you glad to have done that work?
I'm very happy with the returns on my book, because you cannot imagine the numbers of letters I receive every day from higher level politicians, from sometimes journalists, from the general populations, from hundreds and thousands of general practitioners, from my former bosses, all professors of medicine in the Academy of Medicine, of Surgery, everywhere, saying congratulations, you save the honor of France, of the French medicine, you're really, you follow your Hippocratic oath. So it's every day I receive letters like that. So for me, it's the most important thing. And I received very few, maybe less than 10 letters of insults, but 1,000 letters of congratulations. So for me, it's very important. I see that all the GPs follow me now in their head. Now they are not allowed to speak up. And
you lost someone very close, I understand, to COVID, whom you didn't treat yourself.
Yes, it was my brother-in-law, the husband of my sister, who died. And he was in another city. There was a lockdown. I couldn't see him. I couldn't ask him to come in my hospital. He arrived in the hospital. He was not in so severe conditions, just a little bit of oxygen in his nose. And when I had the physicians on the phone, he said, "No, we are not allowed to give hydroxychloroquine." I said, "Why? It's authorized in the law." At that time, it was still authorized. He said, "No, because the university hospital of the town said that we should not give it out of the official clinical trials such as Discovery." And they let him in his room with a little bit of oxygen, paracetamol, and he died. 1 week later, without effective treatment, which was known to work. And I was very upset about that. That's why I spoke about this personal story in the media.
And you know, the next question was, how are you coping with this number of deaths and all this, you know, this number of preventable deaths, you see, and what should be a process for, essentially, for society to reconcile with this episode, because right now there is a huge division in the French society about what happened because of the death and the preventable death.
I said in the media that if a treatment with hydroxychloroquine, azithromycin, and a good management had been done, we could have avoided between 20,000 and 25,000 of deaths. I was a lot of criticized, but now we have the confirmation. If you compare France and Germany, if you compare the hospital of Marseille with all of the other hospitals in France, if you compare France with Morocco, Portugal, and so on, everywhere you arrive on the same counts. So we could have avoided a lot of cases of death. That's why I'm upset, because I said that in the TV at the beginning of the crisis. Nobody in the authorities didn't follow me. After the crisis, when I said that, they said, "Oh, it's easy to speak afterwards when everything is done." I said I'd never change my speech from the beginning to the end of the crisis. I always said the same thing, in opposite to all my colleagues who change their speech from 1 week to another. So I was very upset. That's why I wanted to write this book, to tell the truth to the French population and maybe to other countries.
So I have to thank you again, Professor Perronne, for your participation in this interview. I think it's going to be an eye-opener for many in the world, and we may get feedback. We'll forward it to you. I think many people are not aware of really what happened in France and see it only through kind of a lens of demonization of Professor Raoult, because he was the person to target. If you basically eliminate his credibility, then you eliminate hydroxychloroquine as a threat, and that's basically what has happened to a large extent. But there is a huge story that you told in your book, and also make sure that do you have any plans to put it in English?
I'm not sure, because it was a very Franco-French story, but maybe if it's interesting other countries, why not? It's possible.
Okay.
Thank you very much. So it was a pleasure for me to exchange with you, and I hope that if I can open the eyes of some physicians and people in other countries, it will be a pleasure for me.
That's amazing. That will be the last word of the interview. Thank you so much again.
Thank you.